Ryan Osborne here with Denver 7, joined today by Dr. Aaron Provance, the medical director of the Sports Medicine Center at Children's Hospital Colorado, talking today about some of the challenges of playing youth sports, high school sports, and youth sports in general during COVID-19. Dr. Provance, what is the main challenge that you've noticed over the last year of children getting back into sports while also being cautious?
So I'd say we're attempting to achieve a balance here, and it's really between mitigating the spread and risk of COVID-19 through physical distancing and proper hygiene, and then also balancing that with the importance of sports and exercise and promoting health, mental health, physical health, and also cognitive development.
But what are some either lingering health issues that you've seen either here in Colorado or just kind of monitoring these issues in general across the country? What are a couple concerns regarding children getting COVID-19 and recovering from it?
I would say the more concerning or most concerning health condition that we see with athletes getting back to sport would be myocarditis. And this is an inflammation of the heart muscle or muscles that can lead to abnormal function, whether that be like the pumping effects of the heart or even the electrical system of the heart can be affected. And that can lead, of course, to issues with electrical conductivity, which can lead to arrhythmias and other things that can happen with sports. So what we're recommending is if the athletes had symptoms for longer than 3 days, then we recommend that they see their primary care physician for this. And all these infections really should be managed by their primary care physician. Their primary care doc may recommend that they have an EKG done of their heart to see if there's any signs or symptoms of myocarditis. And for those athletes that are having more of a moderate or severe illness or have to be hospitalized, they may even have to have cardiac workup. But this is, again, all dependent on what the primary care physician sees and how they want to manage the patient.
CHSA had a high school football season that was a success, but not without its hurdles and challenges. What are the challenges specific to indoor sports like basketball, volleyball, compared to outdoor, which has seemed to be a safer setting with COVID-19, but now you get all the kids in gyms and more confined spaces? What are the issues that come up with that?
I think that's a really important topic to discuss today. And we know that transmission of COVID-19 in indoor spaces is higher than outdoor spaces. So the recommendations for those sports being played and participated indoors is different. For the majority of those indoor sports, it is recommended that a face covering be worn at all times, whether that be practice or competition. But I would say there are certain sports where that doesn't always apply. So I want to mention 3 different situations where that may not apply. So for swimming and diving, for example, if you had a face covering on, if it got wet, you wouldn't be able to breathe very well. So for swimming and diving, the athletes will need to take off their face covering, of course. There are some sports where choking hazard could be a risk, and the risk outweighs the benefits of wearing a face mask. So one of those sports would be wrestling. And then another sport that I'd want to mention where a face covering could impede the vision with some of our athletes in like gymnastics and cheerleading, where these athletes are in the air, and if that face covering then goes up over their eyes, they may not be able to spot the landing, and that could be a situation where we could have a high risk and have a much more serious injury. So those are the sports where face coverings may not be appropriate just with competition.
And if a child tests positive for COVID-19 during their sports season, they're obviously going to be quarantined based off of the district's guidelines. But as far as returning back to competition and returning to practice, what is your guideline that you're telling CHSA and telling schools when you advise them?
There are a lot of things that the schools and CHSA are doing to help decrease the spread of COVID-19. And of course, the schools are following those guidelines, but our local health departments are the vital pieces here for making decisions, whether that be on low versus high risk exposures, whether the athlete needs to quarantine, and for what duration they need to quarantine. And then if a patient is infected or has a positive test, how long that isolation period needs to be before they go back to sport. And of course, going to their primary care physician to let them know that they've had COVID infection, and have the primary care physician doing a full examination of their heart and lungs and really their whole body to make sure that they really are ready to go back. If they had symptoms for longer than 3 days, we recommend that they go through a return to play process or protocol where they gradually continue to increase their level of physical activity to look for signs and symptoms of exercise intolerance or troubles that may be arising from myocarditis or some other kind of condition.